I thank you, Sarah. I'd like to welcome everyone to the Healthy Start Coalition of Sarasota County's parenting series. Today is answers to your questions about COVID-19 vaccination. Today, this presentation will answer most frequent questions about the COVID-19 vaccine. If I plan to get pregnant, or I am pregnant, or was recently pregnant, and how now breastfeeding, is it safe for me to receive the COVID-19 vaccine? What about my family? Should they be vaccinated? I'd like to introduce Dr. Washington Hill, who has been a board member of ours for a very long time. And I'm just going to tell you a little bit about him. But the first thing I want to say is that it is his birthday today. So happy birthday to you.
Thank you.
Dr. Washington Hill has been a member of the Florida Pregnancy Associated Mortality Review Committee for many years. Dr. Hill is the founding director of the Maternal Fetal Medicine at Sarasota Memorial Hospital. He has a strong interest in maternal mortality and preventing it, education, patient care, and clinical practice, and is also a regular participant at conferences throughout the country. Recently, he completed 2 years in Rwanda teaching African medical students, residents, faculty, and staff Safe Motherhood. Dr. Hill is a senior physician in women's health at CenterPlace Health and has practiced at SMH for 29 years and has delivered babies for 55 years. Today, Dr. Hill is involved daily in the care of high-risk obstetrician patients, including those with substance use disorder, promoting safe motherhood throughout Florida, diversity, equity, and inclusion, perinatal community education, and reviewing obstetrical medical legal issues. So welcome, Dr. Hill. Thank you for joining us today.
Thank you. Now, if I can figure out how to share my screen. Can you bring them up? I'm sorry. There you go. Next slide, please. Now, what we're going to do, everybody hear me?
Yes.
And we want you all to participate, is to answer questions about the vaccination. And to get us started, I thought I would make up some slides and some questions that are asked. And actually, about a half an hour ago, somebody called me and asked me another question. Thanks a lot, Sarah. This will work just as well. And then you'll have to give me sharing 101 again. So we want you to ask any questions that you may have, and we hope that we can answer them. Let's go to the next slide. Now, there are a lot of questions, and the best source for answers to questions about COVID for our staff and board members, et cetera, is the CDC guidelines. And those guidelines are published, I think, almost every day. I had the pleasure of going to CDC some time ago to talk about maternal mortality. And they have staffed, and this is all they do, and they do it probably over the night and come up with questions and guidelines. So if you have any questions, I do this, and many professionals do it. That's the best place. And the other nice thing about it is they are very succinct. So let's go over a few of the questions that I've been asked, and I'm sure you may have on your mind, and that CDC has felt important to answer. And this is interactive for a small group, so if we have any question while we're on that slide, please just speak up. On the left will be the question, and on the right will be the answer. And this is an important question. My niece has 2 children. Both of them were COVID positive, and this question came up. How long do I have to be in isolation and precautions after COVID 19, sorry about the spelling, COVID-19 illness. So how long should those boys be in isolation, right, after they have had a positive test? And the answer is here. Isolation precautions can be discontinued 10 days after symptom onset, so 10 days after they had symptoms or a positive test, and after resolution of fever and other symptoms for at least 24 hours. So the answer that the Department of Health in Maryland told her was 10 days. Now, the important part about that to my family is that 10 days means 10 days, correct? Doesn't mean 5, doesn't mean 8, and then they can go to a birthday party. It means 10. And one of the problems that we have with COVID is, well, can I wiggle around this somehow? And I'll come back to that in a bit. So the boys should be in isolation for 10 days. Next slide, please. So what does CDC today, February the 19th, that's easy for me to remember, what does CDC recommend today regarding prevention? And this came up here in Sarasota, right? Because the mayor called a number of us and said, what should we do in regards to our mask mandate? And this is what CDC recommends today, not Washington Hill, not Manny Agudillo, not Lisa Merritt, but CDC. All people, regardless of symptoms, and regardless of whether or not they have had laboratory confirmed COVID-19 in the past, continue to use all recommended prevention strategies. I think that said all people, right? Didn't say all people except those in Sarasota, or except those in Florida, or except whatever. It says all the people. Next slide, please. So what are those strategies that all people should be using? Wear a mask, and it can be single or double. Recently, double was suggested. Single if you have a surgical mask, and I thought I had one here, like we have at the hospital. And if it's a tight fit, the reason that double came about was that the general public are not using surgical masks, and they're not a good fit. And how many times have you been, I've been to the post office or wherever, where it's not a tight fit at all because it's hanging down under the nose. And I'll say it now, and then I won't have to say it again. The mask should cover the nose. And there were several studies that suggested that 2 masks, particularly those that are being used by the public, are better than 1 mask. For us in the hospital, we use 1 mask because it's a tight fitting mask. Someone has suggested if you have on a mask and your glasses are getting foggy, then the mask is too loose, right? Because some of your nose heat is getting on your glasses and it's not a tight fit. So it's going out. And remember, this is a very contagious virus and it's coming back in. So wear a mask strategy. Stay at least 6 feet away. Some debate whether it's 6 or 10. From others who do not live with you. Avoid crowds. Crowds has been defined variously as 10. And wash hands regularly or use our favorite hand sanitizer. Those are the strategies. We've known them since last February. Any questions? Next slide, please. Please speak up if you have questions. Like, where did Dr. Hill get that from? Everything we got here is from CDC. Is the vaccine safe and effective? It is safe and it is effective, and we'll talk about the effectiveness in a minute. So yes, vaccines are safe and effective. There's no indication they are not. Remember, several million people have received the vaccine in this country. No evidence, no signals, that's what they're called, that they are not safe and effective. And remember that the studies that were done, that were presented to the FDA, those folks are still being watched as well. So it is safe. Now, one of the questions that always comes up when we ask someone, are you going to get the vaccine? In fact, I asked a patient or somebody, are you going to get the vaccine? And she said to me, no, I'm not going to get it because this was developed very quickly and we don't have the cure for cancer yet. And I don't know what it's going to do to me in 2 years. Well, you're right, ma'am. We don't know what it's going to do in 2 years because the vaccine has not been out for 2 years. One of the doctors who works at NIH explained the fastness very nicely in that this vaccine, other vaccines were being developed. And then this vaccine needed to be developed and they pivoted. So the many techniques, studies, research that had gone into developing other vaccines like Ebola were switched to this vaccine, and that's how so quickly it was developed. And it was a 24/7 operation, all hands on board. Next slide. So it is safe, it is effective. Do vaccinations really work? I think the answer to that is yes. Think of smallpox. When some of us on this call were small, smallpox was a real disease, and smallpox has actually been eliminated by the smallpox vaccine. Next slide, please. Okay, so if I am pregnant, can I get the vaccine? Yes, you can. And this becomes a discussion between the patient and her physician. So if I had a patient who asked me, Dr. Hill, should I get the vaccine? We'd have a conversation. And if she said, why should I get it? We'd have a conversation. And that conversation would sound something like this, that there is no harmful effect as far as we know at this time from a pregnant woman getting the vaccine. Remember, this is a genetic vaccine. There's no reason to think that it would alter anything in the fetus. And at this time, there's no evidence that it can. There is some evidence that the virus may be transmitted to the fetus and may cause a problem. But the only thing that we know at this time is that transmission to the fetus may occur. Now, in terms of the other thing we talk to the patient about is that it does appear that if you're pregnant and you get COVID-19, that your disease may be a little worse than the patient who is not pregnant. And a little worse meaning that you may need to be hospitalized and may end up in the intensive care unit. So you kind of have to balance that and those effects against the vaccine, of which we know there are no effects. So if a patient asked me, I would discuss that with her, and then she would have to decide. But well, the vaccination sites are certainly open to of those eligible people who are pregnant. For example, healthcare workers, a nurse, right, who's pregnant. Any question about that? So most of our nurses have to have that discussion with their doctors and then decide. We have had COVID-19 among pregnant patients at the hospital. Some of them have done very well, and some of them have been quite sick, and none of them have died in our area. As we look at those around the state, there have been several deaths in pregnant women who have been infected with the coronavirus. The exact number we'll find out actually later this year for last year. Next question. Next slide. Here's a good one. I missed my appointment in the hospital or elsewhere to get vaccinated. What should I do? I actually was in the hospital yesterday, and there was a woman clearly at high risk. Her BMI was increased, but more importantly, she was the cashier in the cafeteria. Is she at high risk? The answer is yes, even though all of us wear a mask, but she's coming into contact with everybody who comes into the cafeteria. And I asked her, did you get your vaccination? And she said, I was on vacation. Well, I'm not sure what that meant. And she said, what should I do? I said, you need to make an appointment and get your vaccination. And she was gonna, I hope, do that. Now there's some reluctance, and we'll come back to that in a minute. So if you miss your appointment, and this is one of the reasons why we should be telling our patients, if you sign up for the vaccination through the system, and we all know the system is not easy, put the phone number that they're going to call you back in your contacts so that you will know when they call. I believe they call you twice, and if you don't respond, you go to the end of the line. Next slide, please. This is a good one, and this has been asked many times. So do you have to wear a mask after you get the vaccine? I think we go back to the same recommendations from CDC. It didn't say after you get your vaccination, you don't have to do all those things, did it? It said everybody needs to do it. And the answer is yes. You still need to be cautious, and that is an answer frequent in the questions that we'll talk about. So once you receive the vaccine, once you're fortunate enough to get the vaccine, whether you're a healthcare worker and you can get it early, or you're over 65, for example, I have some friends of mine from church, they both got the vaccine, and I told them you still have to be cautious. They would like not to be, because they would like to go see their grandchildren here in Sarasota. We'll come to that question in a minute. So do you have to wear a mask after you get the vaccine? The answer is yes. You still need to be cautious. Questions? Next slide, please. Is this a get out of jail free pass? What's the answer to that? No, you still need to be cautious. When will we be able to get out of jail? That is a subsequent question, and the answer varies according to who you talk to. The answer is going to depend on those who have been vaccinated and herd immunity. Herd immunity means that so many of us have been vaccinated that the virus eventually just quiets down. And we need folks to get vaccinated to get to herd immunity. There's two ways you can get to herd immunity, right? One is by vaccination, because you develop the antibodies, correct? What is the other way that you develop the antibodies? Anybody?
You contract COVID.
Thank you. You contract COVID. My nephew contracted COVID, and he is building his antibodies. There's some evidence, I read in one research article, that the antibodies from the disease are stronger than those from the vaccine. So that's a question, but that's the second way. So we don't want to have people contract the disease to develop antibodies, because we would lose a lot of those patients. So the better way is for us to get the vaccine. But it's probably going to take up to 75% to reach herd immunity. And if we are as good as getting the vaccine as we have been with using the mask, we have a problem, correct? So that's why many efforts are out there to help us and encourage us to get the vaccine. Next slide, please. What happens if, because of the Midwest snow, I miss my second shot? And was on a call with Mr. Henry yesterday or so, and this may happen. Although it looks like the vaccinations, the shots that were supposed to come in today came, which is wonderful. So what happens then? Whenever they come, you need to get the shot. Just as soon as you are able to and told to get your second shot, you should. There is some evidence that, remember, the time for one shot is 3 weeks and the other a month, that's not in stone, that if it's a little bit off, you're still okay. Remember, that shot is being given to produce a boost in your antibodies. So the answer to this question is, and there was a clinic Thursday and Friday at Sarasota Square Mall, is closed because they don't have the vaccine.
Dr.
What should you do? And you should get it. Yes, please.
Sorry, there's a question in the chat asking about if asymptomatic COVID carriers, are they getting tested before getting vaccinated? And is there, what happens if you're asymptomatic and you get vaccinated?
No one is getting tested before they get the vaccination. No one. What is asked is, have you had COVID? And then, if I recall correctly, it's 10 days, maybe 10 days or 2 weeks, and then you can get the vaccination. But no one is being tested. You are being asked, and I want to say it's 10 days. I can check on that. And what was the second question?
So I think related to that, it's maybe, would there be a reaction if you were asymptomatic and received the vaccination?
Not at all.
Okay.
Not at all. But there is a period of time where you need to wait from when you have had the infection. And I want to say it's 10 days. Because when you receive the vaccine, you are asked that question. I want to say it's 10 days. Remember, the vaccine, it just induces the immunity and induces you to form antibodies. So this question is a real one. It looks like the doses that were supposed to be given actually on Thursday and Friday, well, on Friday, are now here because there will be a pop-up center at one of the churches on Sunday. And we were afraid that we would not have the vaccine, but I was told this afternoon that we will. Any comment or question about that? Next slide, please. Thanks, Sarah. Will we have to get the vaccine again? The real answer is yes. And the question is, how long does the immunity induced by this vaccine last? It's not forever. And the evidence would suggest it's 1 to 2 years. So, hate to tell you, we're going to be going through this every 2 years, correct? So this go round will probably last 1 or 2 years. We'll find that out when we look at the patients who are being studied, that were in the study. But the answer to the question is probably 1 to 2 years. It's sort of like the flu shot, remember? And particularly now that we're having variants, it's probably going to be every 1 to 2 years.
So can I ask a question, Dr. Hill?
Of course.
You mentioned herd immunity.
Mm-hmm.
So if there's variances, does that negate the ability to get to herd immunity?
It doesn't negate it, but it softens it because the herd immunity is against the, let's say, the first genetic type, the one that we're fighting now with the vaccination. And with the variants, which is another point, the variants are affected by the vaccination. Probably not as good as the first type, but it is. But then this is the variant from England. The answer to that question of whether or not the variant from South Africa is the vaccine is effective against that variant is still being researched. But you're right, the herd immunity is to the first type of the virus, the first genetic type, and to some effect of the other two, as I mentioned. It's sort of like the flu. Does that answer your question?
Yes, sir.
So unfortunately, this is not a one and done, which is not going to make it easier for us to encourage people in 2 years or whatever it is to get the vaccine again. Is it? Next slide, please. What happens if I get the vaccine and then get pregnant? Or another part of that question is, what happens if I'm trying to get pregnant? Should I get the vaccine? Or what happens if I'm breastfeeding? Should I get the vaccine? There's no evidence that the pregnancy would be harmful if you got the vaccine. Remember, most of these healthcare workers are high-risk folks. But let's say there's a healthcare worker, she's trying to get pregnant, she's a healthcare worker, should she get the vaccine? My answer to her would be yes. There's no evidence that if you successfully get pregnant, that the antibodies from the coronavirus is going to hurt the pregnancy. And can a woman who's received the vaccine, pregnant, breastfeed? The answer is yes. And another part of that is, can a woman who has had the coronavirus during pregnancy breastfeed? And the answer is yes. We do suggest that she wear a mask while she's breastfeeding, and it is encouraged for her not to use the breast that has cracks or nipples in it. And again, we've had patients who have had coronavirus during the pregnancy. Next slide, please. Oh, well, can I take the kids skiing? You know, spring break's coming up, right? And the question is, can I take the kids skiing now that I got the vaccine? Now, as you know, the administration of the vaccine to children is still being studied. And under 16, it is not recommended that they get the vaccine because it's still being studied. Okay, so can I take my children to Utah to ski after dad, if he's a healthcare worker, if he isn't, he's not vaccinated, but this was a nurse who was vaccinated. And the answer to this is you got to think of the risk. And the answer is probably not. And why is that? Well, one, your vaccine is not 100%, and we'll come back to that in a minute, but the children have not been vaccinated at all. Going back to my nephews. So they certainly can get the coronavirus. And then remember, your partner who has not been vaccinated can certainly get coronavirus in traveling. And then remember, you're traveling as well. So this becomes a matter of risk that all of us have to think about. I went walking this morning. I did not pick an area that was completely dark. I picked an area that was light to decrease any risk. And I think this is true here. So the answer to this, if somebody asks me, the answer is probably not. Not a get out of jail free pass. Any comment about that? Does that make sense? Next slide, please. And this is a good question. And there was some discussion about this on the air a couple of days ago. What if our family develops an immunity bubble of vaccinated friends? So that all of your friends, another couple, maybe a third couple, have all been vaccinated. Can we then hang out together, have a dinner party, go skiing together? And the answer to that is maybe, because you all have been vaccinated. Of course, the children have not. But if you all have been vaccinated and are abiding by the rules of not associating with non-vaccinated sinners, then you probably could do it. But again, it's a matter of risk. Next slide. Before I get to the next slide, let me give you another example of a phone call that I received recently. And as you know, this whole system of registering is improving, but not the best. So you may end up having grandma on more than one list. Make sense? Okay, grandma's on list A and list B. And the folks from list A call and say, grandma can come in on Monday for her second shot. So what's going to happen to grandma's name on list B? Would somebody like to unmute and tell me what should happen? Anybody? What should happen with grandma on list B?
I
Sarah,
think Cheryl's talking, but we're not hearing her.
Marilyn, what do you think should happen with grandma on list B?
Well, in the ideal world, the systems would communicate somehow, but that's not going to happen. So
That's
I
not
think
gonna
it behooves the person who gets the second list B notification and to decline and say that they've been vaccinated.
Right. Whoever registered for grandma should call the people on list B and say, thank you very much, but grandma is going to be vaccinated on Monday at wherever place A is. That is what should happen because everyone's waiting. So someone asked me, well, can Mrs. Jones down the street, who's been waiting to be vaccinated, be put in that spot? What should be the answer?
No.
And that was clearly the answer. I'm sorry, Mrs. Jones down the street, who's been waiting, who is eligible, who may be on another list, should not be now put in grandma's spot in list B. And what really happens with that is the next eligible person goes into that spot. And that someone actually called me about that. Okay. What symptoms might I have after vaccination? For those of you out there who have been vaccinated, you know that after the first shot, you usually don't have much of a problem at all. There's a little soreness in the arm. You're not going to be able to sleep on that arm. If you do, you'll remember very quickly that you got a shot today. A little Tylenol will be helpful. You may have a little fever. You may take a few extra naps and have some aches and discomfort. After the second shot, it appears that these symptoms are more bothersome, and most of us feel that that's an indication that you're forming antibodies. And the studies also showed that the younger you are, the more symptoms you have after the second shot. Some of our nurses had to call in sick, and that's why they rotated the units for getting the shot. Otherwise, the hospital would have a whole bunch of people not in the next day, so they rotated it. And yes, the younger people had more symptoms after the second shot.
Dr. Hill, I heard something interesting today from people in the Miami area who got the Pfizer shot, not the Moderna like we did, that some people are experiencing after the second shot with the Pfizer one, 10 days later, some dizziness and lightheadedness, which was news to me.
That's news to me. I had not heard that. But certainly after either, there appears to be more soreness, fever, tiredness, aches, discomforts in the younger population.
Dr. Hill, do they know why that is?
We think that's because they're building antibodies.
But wouldn't it be the same for the older population?
Well, it's a great question. And the reason it might not be is because as you age, your ability to form antibodies decreases. And that has to do with your immune system. Your immune system is not as robust when you're 75 as it is when you're 25. You with me?
Yes. So would there be an age where it would be pointless to get the vaccination?
I don't think, the answer to that I think is no. But as you get older, you have to realize that your immune response to the vaccine is going to not be as good, as robust, as if you were younger. And it may not be as robust because of some medications that you're on, which decrease your immune system's response. For example, patients who have had a transplant. Next slide, please. So expect some symptoms, but a little Tylenol, you'll be fine. When will we achieve herd immunity? I think we've discussed that. When about 75% of us are developing antibodies one way or the other, and most of those are by vaccination, and midsummer maybe. Depends on how many of us received the vaccination, correct? Next slide, please. This is a good one. And our Black and brown folks and those who don't trust the government, does the vaccination change my DNA? You're telling me this is a genetic a virus? No, it doesn't change your DNA. Not at all. Doesn't change your child's DNA if you're pregnant. Next slide, please. And this is a good one. Grandma is hesitant. Just think of this. Grandma is hesitant. Let's say that grandma is 67. She's eligible for the vaccine. She has diabetes. She's Black or brown. Has comorbidities. She's overweight. And you ask her, Grandma, you want me to register you for the vaccine? I can hear this now. Nope. Nope. I don't want the vaccine. And the answer to that is we have to sit down and talk with grandma. And I feel, and most of us feel, that our job is to educate the population, educate people, and make sure that they fully understand, not what they heard from somebody else, but they fully understand the facts.
Okay.
And if after they have heard the facts and understand the facts, and they say, thank you very much, I don't want to get the vaccine, then that's fine. And I think this is what we do, we being the collective we, Healthy Start, different groups, the hospital, neighborhood groups, etc. This is what we do in trying to educate the grandmas of the world. But they need to hear the exact and the truthful facts. But there's a lot of reason for that distrust. And we have to try to help them get past that. Some of it has to do with trusting the government, and after the years that we've had recently, there's some distrust of the government. Is the government telling me the truth? And you know what we've heard over the last number of years. So my answer to this is, let me talk to your grandma, let me give her all the information, let me give you the information to give to grandma. And if grandma fully understands and says yes, and if grandma understands and says no, that's fine. At one of the center in Newtown, there was a lady in line, and I was up there, and she said, Dr. Hill, I'm so glad that you and others did that webinar because I had questions and you answered them, and that made me be less hesitant, and that's why I'm here. But unfortunately, there's going to be a large population that will not get the vaccine. There was some data reported yesterday that 50% of healthcare workers will not get the vaccine for a number of reasons. Produced too early. I don't trust it. one person said, they're following the patients who received the vaccine, so there must be some reason for doing that. And I think I'll wait until that data is in. Next slide, please. This is important. How effective is the vaccine? It's 95% effective, the two that we have available. Others are less effective. So one important point is it's not 100%. That's why it's not a get out of jail card. It's 95%. That means you still have a 5% chance when exposed to the virus of getting the virus. So just keep that in mind. Make sense? It's not 100%.
Right. But if you get the vaccine and then you get COVID, the likelihood it does reduce your symptoms, correct?
Did you look ahead at my slides?
No, I was just asking, sorry.
That's a question, and we'll answer it now. And that is that if you get the vaccine and then get the coronavirus, it reduces your risk of severe disease, like ICU disease, ventilator disease, and dying. So you're absolutely right. Next slide, please. When might things get back to normal? Well, whatever normal is will never go back to normal. Zoom virtual conferences will not go away. We may have hybrids. I just did a hybrid with a group in Ethiopia. They were in the Hilton Hotel. And the other part was if you didn't want to go to the hotel or if you wanted to participate from wherever in the world, you Zoomed. So when will we be back, for example, and having large conferences in a hotel? I'm not sure that I will ever go to one again. To be truthful, I probably will go to smaller conferences and the bigger ones will be hybrid. When will we be able to go? I know that Sarah likes to go to the movies. When will I be able to go to the movies and chill out? Maybe the winter, maybe next year. Unfortunately.
How about cruising?
Oh, that's a good question because a very good friend of mine is a cruiser. That's what CDC is going to have to determine that. And I'll bet you it's not going to be this year. It's not going to be this year. Next year. And I know some cruisers who want to go. I mean, would you go on a cruise this summer? I think most of us would say no. No, I'm not going on a cruise. And unfortunately, some people have decided to do that, and they're in my family, you know. All you can do is tell people, all you can do is advise them. But I certainly wouldn't take my family or my children on a cruise in August. Next slide, please. We'll find that out because Dr. Fauci and the group at NIH will try to help us with that. When am I immune after the second dose? After the second dose, 1 to 2 weeks after your final dose, which is the second dose. 1 to 2 weeks. So that's why you can have someone, you've all heard this, I received the vaccine and then I got COVID. Well, if it's the first dose, you didn't have yet the amount of immunity that you needed. That's why you need 2 doses. And if it's the second dose, you can see there's a window where you still have to build immunity. This is not an instant fix. And we hear so many people say, okay, well, I got my first dose. I can see the grandchildren, or after the second dose, well, some folks are coming down and that's cool. Remember, you can still get sick, less sick, but you can still get sick even if you completed 2 doses. And remember, when we talk about grandchildren, as we were talking earlier, my ability to build antibodies is not the same as a 22-year-old for a number of reasons, but it's not the same. The 22-year-old has a far greater ability to respond to the vaccine than Dr. Hill. Next slide, please. I think we're just, oh, good. After I get vaccinated, can I still carry and pass on the virus? So after I get vaccinated, I've been vaccinated, can I still carry the virus and pass it on? And the answer is yes. I can do that. I will get less sick, thank goodness, but I can still carry and pass on the virus. So one of the issues about that is if my healthcare worker gets the vaccine and then she gets coronavirus, she can go home and still carry and pass on the virus. Maybe to an amount of the virus less than if she had not been vaccinated, but there's no question she can pass and carry. Now, the current research is to try to answer that question. If the virus is present, can she pass it on? For now, the answer is yes. Hopefully, the answer will be no. But right now, the answer is yes, you can carry it and pass it on. That means you can go home and pass it on to grandma. Next slide, please. Are eggs used to produce the vaccine? And the answer is no. There's no reason to suspect that. And that brings up the question, I'm allergic to whatever. Can I receive the vaccine? The answer is yes, but those folks, for example, in line, someone will say, I'm allergic to penicillin, can I get the vaccine? The answer is yes. But everyone who receives the vaccine, we watch them for 15 minutes. So, question came up yesterday at a conference, have we seen any serious reactions here in Sarasota County? And the answer is no. There was one woman at the hospital who fainted, was sent home after that. But the question did come up yesterday at a call. Any serious reactions reported? And the answer was no. Next question, please. When will there be enough vaccine? Well, that's a good question. And remember that when there is, we'll have more pop-up clinics, more opportunities to get on the list, et cetera. And the answer is when there's enough production and less snow. So when there's enough production, this is going to be very helpful in getting the vaccine out to the Costco's, Walgreens, Publix. Having said Publix, remember that one of the things, when you look at the statistics, the percentage of people who are white that get the, let me put it this way, the percentage of vaccine that's given out to white folks is higher than it is to Black and brown people. There are probably 2 reasons for that. One is Black and brown people may not want the vaccine, and we talked about that. But the other is access. And we have to take the vaccine to the people. We can't ask people to come out to Sarasota Square Mall or when it was at Twin Lakes. we have to take the vaccine, just like we did with the screening, to the people. Now, the numbers will always be different, but we have to be about the business, and the collective we from the Department of Health on down is working on that. Next slide, please. Well, that's the last slide. You're welcome to unmute yourself and ask any questions that we did not answer. Any comments, questions?
Dr. Hill, is there information on how the vaccine metabolizes or known information on that yet?
Yes, and that after a very short period of time, and I have to look up the exact days, there is no vaccine in the system. None. The vaccine has done its thing, which is to stimulate the immunity. But after X period of time, and I'd have to look it up, but I believe it certainly was less than a week. It was a number of days. There was no vaccine detectable. Well, I hope that has answered questions and give you information to share with our clients and your family and friends.
Just saying hi, happy birthday.
Thank you, Tiffany.
Good job. Thanks for the information.
Thank you. My brother's birthday as well.
Twins will do that to you.
Friends will do that to you. All I can say is we've been very fortunate and God's been good to us. Thank you very much. Have a good rest of the day.
Thank you.
Thank you.